The opinions expressed by Peter Wexler, Robert Quitner, Kyle Plotkin, Michael Hart, Nicholas Hamner, and guests on this show are their own and do not reflect the opinions of this network. All statements and opinions expressed are based upon information considered reliable, although it should not be relied upon as such. Any statements or opinions are subject to change without notice. Investments involve risk and, unless otherwise stated, are not guaranteed. Past performance cannot be used as an indicator to determine future results. Any strategies mentioned may not be suitable for everyone. Information expressed does not take into account your specific situation or objectives and is not intended as recommendations appropriate for you. Before acting on any information mentioned, please consult with a qualified tax or investment advisor to determine if it is suitable for your specific situation. This program is designed to provide accurate and authoritative information with regard to the subjects covered. Investment advisory services offered through Brookstone Capital Management LLC, aka BCM, a registered investment advisor. BCM and Franklin Retirement Solutions are independent of each other. Insurance products and services are not offered through BCM but are offered and sold through individually licensed and appointed agents.
All right, welcome to this week's episode of Solving the Retirement Puzzle, presented by Franklin Retirement Solutions. I am Nick Hamner. I am the host, and with me this week, as they are every week, except for last week when we didn't do one, is Michael Hart and Kyle Plotkin. We are going to talk about things related to, news items, interesting tidbits related to retirement and income planning, because that is what we do at Franklin Retirement Solutions. We are retirement and income planners. That means we help people that are getting ready to retire or who have just retired figure out a way to retire and stay retired. No going back to work for anybody here.
Unless you want to.
Unless you want to, yeah. No one's forced to go back to work unless you are really bad with money.
That's a spousal privileged kind of issue there.
Yeah, I think we saw a couple guys on the golf course yesterday, like working the golf course, who were well past retirement age, but clearly.
Oh, no, that's
I have at least one client that does that, yes.
That's the golf course monitors. That's the guys working at Ace Hardware. That is, where else? Volunteer fire departments. Guys that are retired that basically you get the feeling we're kind of eased out of the office, but don't want to go home.
Yeah, they're trying to ease you onto the next hole.
Uh-huh.
Yeah.
I don't know where you meant to hit it, but there's a Dunlop 20 yards that way. I may have heard that before.
we didn't get any go from the marshals yesterday.
No.
And one guy drove by and just asked us how we were doing, but he didn't say we were playing slow. So.
Yeah, it wasn't that crowded.
Oh, you haven't heard oh man, that would have been a great shot if the hole was over there.
No.
I did sky one about 75 yards over a green though.
We all lost our fair share of balls, I would say, yesterday. Rob lost a few.
Oh, well.
And obviously I lost a few.
I've never seen so many weird bounces on a golf course in my life.
Well, when you're playing on AstroTurf.
AstroTurf would have been preferable. We were basically playing on...
Rob somehow hit a handrail on this one.
Yeah, I was just going to say. So...
Which had more balance, the turf or the handrail?
The handrail.
This is great pod, by the way. But, yeah, so the green obviously is, he's aiming for the green. And to the right of the green is this, like, railway.
Mm-hmm.
He hits the green or hits the railway. It bounces all the way over the green and ends up on the left.
I remember the last time I was playing golf. It was when I hooked one so bad off a drive where the tee box was literally surrounded by houses that you honestly question what kind of language do the children living in these neighborhoods pick up. Because I know what I said, and it was completely original and vulgar as all get out, and anger. It was completely out of anger. Those kids must have amazing vocabularies. But...
Well, Middletown, so there's
that whole neighborhood
all over there. So we were talking about that, and
how
easy it would be to hit a house if you really.
My one buddy did like a couple years ago playing over there, and the guy that owns the house, he hit him in the deck.
Uh-huh.
So the guy comes out, oh, what are you doing? My buddy's, dude, you live on a golf course. Shut up.
There used to be a golf course in Tuscaloosa. It is long gone because it was pretty much gone when we played it. the swamp had taken over the 8th green, so they just cut the fairway at the end a little shorter and put a hole and a flag in it. The highway ran next to it, and it was like elevated because there was a river, the swamp and stuff back there. But with a pitching wedge and a lot of determination, you could get to the highway from the tee box.
Yeah, I imagine.
One even ricocheted off the billboard onto, we were in our early 20s.
Nothing but net.
Nothing but breaks.
It was you, right, that had one yesterday where you almost chipped it into the hole.
Yes,
Yeah.
almost.
Yeah, but then of course it ran, 40 yards down the green. But I mean,
it'll do that when
it landed right next to the hole.
Got to turn a birdie into a bogey. That's how you do it.
So we got a podcast here to do, huh?
We do have a podcast here, and I am going to talk about, we've talked enough about golf holes. Listen to this segue. This is great. We've talked enough about golf holes, but we don't talk enough about a big hole that people run into because Medicare kicks in when?
65.
Right. What's the average age people retire?
62.
Right. So there's that 3-year gap, and there's plenty of people that are out of work prior to that. And if you've worked your entire life and your workplace has handled your insurance for the majority of it, all of a sudden you get to your late 50s, early 60s, you aren't working. You're not going to pay for Cobra, and Cobra only lasts so long anyway. You're now responsible for finding your own insurance, and it's not anywhere as simple as it is when you're working and they say, here's your health plan, and you just go, okay, and you sign off. So for the vast majority of people, you are looking at the exchange. The Affordable Care Act, all its provisions allowed allowed states to create their own exchange or join the national exchange. Pennsylvania created their own exchange called Pennie, Pennie, for Penn Insurance Exchange. I don't know if you got that.
Thank you for
but
that.
and the only reason I'm even looking at this now is a friend of mine's mother is in her early 60s. She is entirely dependent on Social Security, no savings, no pension, anything like that, just Social Security. She's living with my friend. She slipped on the stairs, busted up her neck pretty good, was in a neck brace for 8 weeks. The neck brace was put on by emergency in the ER, so that was covered. But when the time came to take the neck brace off, she could not find a doctor in her network that was authorized to do that work. So she actually had that neck brace on 2 extra weeks while they hunted to find a doctor in the area anywhere that would take that neck brace off. But because she got the wrong plan off the exchange. So if you're looking at the exchange, there's a couple things you need to know. All of this is available on healthcare.gov, but I'm summarizing here because it's just easier to talk about than to read and try to process. So a lot of people know there are 4 tiers to Affordable Care Act plans. There's bronze, there's silver, there's gold, there's platinum. Those are really divided by what the cost split is. So for a bronze, it's 60-40 with you paying the 40. Silver, 70-30. Gold, 80-20. Platinum, 90-10. There's also catastrophic coverage. That's kind of a quiet 5th tier. They recommend it for anyone under 30, but it's really not recommended for anybody at all. It is the lowest cost, but the highest cost if you ever actually use it.
Right.
Yeah. Unless you're Evel Knievel, you get nothing.
Yeah. So how they determine the pricing is one thing, but there are tax benefits. You can get not really tax benefits, but you can get a partial refund of the amount you spend on your healthcare. That is determined by your modified adjusted gross income. I'm not going to talk in depth about determining modified adjusted gross income or even adjusted gross income because that's a show in and of itself. It's a lot of math. It's a lot of knowing what you make here, what money you have here, but basically your earned income, your investment income, Social Security supplements, all that stuff is factored in as your modified gross income. And there's some things that are deducted out of it. That's why it's modified. But as long as that modified adjusted growth income, or Magi, what do we say, Maggie or
Dude,
Magi?
I don't know that there's a consensus. It's one of the hotly debated topics
Is it?
in the industry. Some people go Maggie, some people go Magi. So
Well, I'm a fan of O. Henry, so we'll do Magi. That's a literary reference for you. The gift of the Magi.
It's off the board.
Yeah, it is. So as long as your Magi is under 400% of the poverty level, which I think right now it's like, for an individual, it's 58,000 or something like that would be that 400. As long as it's under that, you're going to get some kind of credit. Additionally, when you're filling out the forms, there will be you might get prompted for additional savings. That is, where is it? Cost sharing reduction. That's an additional income savings, but that is or cost savings, but that is only going to apply if you do a silver plan. Doesn't apply to bronze, doesn't apply to gold. In that, depending on what you get, as long as you're in your colored tier, your metallic tier, then you get to decide, do I want an HMO, a POS, an EPO, or a PPO? Again, if you've had your employer provide this information for you all these years, if your employer has handled your insurance all these years, you might not know the difference. But HMO, POS, and EPO, they all are going to function out of a limited network. Some may be a wider network than others. I think EPOs are a wider network than an HMO, and a POS is somewhere in the middle. And your ability to work outside of that network of doctors, specialists, and hospitals is going to be limited. It opens up to some extent with an EPO, but an HMO or POS, you're really limited if you ever have to go out of network. HMOs are also limited by area, or can be limited by area, depending on where you are and who provides it. If you go out of state, certainly if you go out of the country, you're really out of luck. The best option, but you're also paying for it because the premiums are the highest, is a PPO, which is a preferred provider organization. That's nationwide coverage for the most part. You can see your specialists and any out-of-network doctors without referrals, and you have lower copays and lower coinsurance, but you're paying for it with that PPO. So really, when you are looking at the exchange and you are looking to see what you want to get, don't be thrown off by the monthly price, because depending on what kind of income you have coming in, and this is something your advisor can help you with, or should be helping you with, is figuring out how to structure your income to take advantage of these things and take advantage of tax breaks as well. When we're talking about taxes, you really have to look at the whole picture. If you're under 30, well, obviously, if you're listening to this, you're not under 30. But if you're in good health, you're not making regular use of doctor's appointments, you're not on any prescription drugs, you're probably okay with a bronze. But if you are seeing the doctor regularly, if you have a chronic condition, or if you have anything that is, you're going in every 6 months or even sooner than that for conditions for your health, if you are taking regular prescriptions, it may be worth it to pay more for that monthly insurance than you probably really want to, but that's something you have to factor in and get your whole picture. And that's something we do, is help people figure out what their entire picture looks like. Money in, money out. What makes the most sense?
I mean, yeah, and insurance is one of those things. Most types of insurance, and obviously there's a ton of them. But insurance generally is one of those things where you get what you pay for.
It is.
And so, yeah, you can get cheap insurance, but it's probably not going to cover a whole lot. You can get super fancy insurance where you're never going to use all the benefits. So you really got to pay close attention to what you're doing. And if you don't know what you're doing, talk to somebody who does.
And it's complicated by design. This isn't a case of the system is broken and needs to be fixed. This is the system is functioning exactly how it was designed. They want it to be complicated. They want you to make a mistake, but it is possible to navigate it cleanly and make the right decision, make the best decision for you. But it does involve a lot of research and a lot of figuring out numbers. And that's something where your advisor should be helping you. That's something where we can help you. So if you have any questions on it, if you want help figuring out what your best insurance option should be, should you find yourself out of work, needing health coverage and not being eligible for Medicare yet, give us a call, 215-657-9200, info@franklinrs.com. Reach out to one of us. We can help you out, get you on the calendar, figure out how to make this work the best for you, and get you on your way. So, Kyle, you said you had some market nerd stuff for us.
Yeah, actually, we're going to talk about today diversity,
Okay.
but not that kind of diversity. So the S&P 500 isn't as diverse as it used to be. Here's why that matters. This came out of the Wall Street Journal. And it's something that we talked about recently, I think a couple weeks ago, but just a little more detail
Right.
on it, is that you can buy an index fund, an S&P 500 index fund. Okay, yeah, sure. You're going to be diversified across 500 companies, actually 503 companies.
Well, to a point, because they're weighted.
Well, that's what I'm getting at.
Okay.
Is and that's what this, back in the 1970s, that was kind of like the holy grail in some ways, was just index, because it wasn't a big deal back then. People hadn't really figured this out. But one of the things was, back in the day when we were more of a, more of a blue collar economy where the service sector wasn't the biggest thing. It was a lot of manufacturing. Industrials and materials made up 26% of the S&P 500 in the 1970s.
Okay.
Any idea what that is today between those two sectors?
4.
10.
10.6.
Okay. You guys are optimists.
10.6% of the index is now made up in those two. And those are very, relatively stable, consistent type sectors. I mean, companies are always going to need raw materials.
Yep.
Industrials, people always need corrugated boxes or airfares and industrials. So all those things are pretty standard. Now, one of the things where there's more volatility is going to be financials. Because financials is largely dependent upon the market. So it's kind of one of those things where it can be an accelerator either up or down. And technology, which is, obviously always growing, and there's a lot of growth funds and growth companies, and a lot of the companies that are in there, they may not necessarily be producing a lot of profit, which makes them growth companies. Even if they are producing a lot of profit, they're not really, they're not paying dividends generally. So that's a big thing, and that's why we kind of look at those as growth stocks versus what we call value stocks.
Right.
But basically, the bottom line here is in the 1970s, tech and financials made up 13% of the S&P 500. What is it today?
35.
45.
42.
You were closer still.
42% of the index today is just financials and tech. 29% tech, 13% financials. So financials now makes up more than industrials and materials did in the 1970s, back when the S&P 500 was considered the safest thing around, yada yada.
And that doesn't even include the fact that Amazon, one of the bigger stocks out there, is technically retail.
Yeah, no, I think that no, you're right. You're right. But one thing I pulled some numbers on, the top 3 stocks in terms of market cap. So basically the top 3 stocks in total value of shares that are out there. 21% of the S&P 500 is made up of 3 companies.
Well, Nvidia's one.
Yes.
Microsoft.
Yes.
Apple?
Yes.
Wow.
Those 3 together make up 21% of the S&P.
So you have if you own the S&P, you have 1/5 of whatever you have invested is invested in 3 companies.
Correct. And the top 10 companies in the S&P make up 38% of the index. So, more than a third, between a third and a half of the S&P 500, or your money that's in there, is in 10 companies.
Well, it's a good thing that Nvidia is primarily involved in AI and cryptocurrency, 2 very stable, not at all suspect industries.
No, of course not. Never. But basically, the S&P 500 is diversified across 500 companies, but it may not be as diversified as you think it is now. If you had less tech, you'd get less growth. You
Mhm.
know, look at the Dow. The Dow's lagging behind the other two indexes by a long shot. But you're going to get a bit more safety, probably a good amount more safety out of the Dow, because that's still kind of set to follow the old economy of industrials.
It is, but it's important to note that safety when discussing the market is still,
Relative.
it's still relative because the market is still risky.
Well, it's always going to be a trade-off.
Risk is risk.
Yep. You know, the more risk, the more reward. The less risk, the less reward.
Right.
You know, where are you in your life cycle? How much do you have invested? What are you trying to accomplish? The other little piece I wanted to pull out of this is the correlation of the S&P 500 with world stocks.
Okay.
So everybody likes to talk about international stocks, world stocks. You know, you want to diversify across all that, etc. Just a little tidbit here. In the 1970s, the correlation of the S&P with overall world stocks was at 0.24,
Mm-hmm.
which means that they did not move in concert
No.
very much with the S&P 500. Right now, it's at 70%.
Well, they're NVIDIA, Apple, Microsoft. I'm sure if you go down the list, they're all multinationals. They're all international companies. The economies have surpassed the boundaries of nations.
Well, the rest of the top 10, you got Meta, Alphabet, Berkshire, Broadcom, Eli Lilly, and Tesla. They're all multinational, worldwide corporations. So you no longer really need to, you know, in certain cases, invest in, let's just say, buy a world stock or a global stock
Right.
fund, because all of these companies that are American companies that are in these indexes, they do business all over the world. So it's, in some instances, you can consider it less of an important stock category, because kind of everything, we just live in a big global economy now.
We do.
But anyway, that was my whole point here, is just, you know, make sure you know what you're getting into. Yeah, the S&P 500 is diversified across 500 companies across every industry. But again, it's not the be all end all, because 21% of that in 3 companies is still a very large risk, and all 3 of those companies are growth companies that need a ton of income to keep going.
Right.
Yeah, and there are ways to offset that. You know, we've seen the sort of growth of the equal weight ETFs that are out there where it's not cap weighted. So, I'm talking about the S&P 500. You know, you own an equal percentage of all those 503 companies. So.
Yeah, and the allocation to different market sectors in that case is a lot more, a lot more evenly matched across the board. You know, like for when we said tech is 29%.
Mm-hmm.
I think was it utility? There's a couple of them that are only like 2%.
Yeah.
Utilities is one. There's I have the numbers, but bottom line is you're going to get a lot more across the board diversification in an equal weighted fund. Now, it's not going to grow as much, most likely, at least in good times, because tech is going to drive the market.
Right.
But, you know, in a down market scenario, maybe the equal weight does do better because it's got more of those industrials and materials type things in there.
Well, big move wise, probably not. But if you're looking to avoid that day-to-day volatility, like NVIDIA was down into last week.
Yeah, in 2022, if you had an equal weight S&P, it probably would have done better than the regular S&P.
Right.
But that's, the one down year out of, the last 5.
Mm-hmm.
So that, again, just something to pay attention to.
Even though we have that giant disclaimer at the start of this, please pay attention. Nothing we are saying, nothing we are talking about, nothing we are discussing is market advice. You should not act on anything we say on this podcast as if it was advice given to you. If you need advice on market moves, if you need advice on your portfolio, speak to a representative, speak to an advisor that is working with you. Nothing we're talking about here is advice.
Yeah,
just talking generally.
Just to that point, also, we're not saying, that the equal weighted, S&P 500 is better than the S&P 500. We're just, to your point, Kyle, saying know what you own inside of a portfolio.
Absolutely.
Know how concentrated your positions are or aren't.
Yeah, absolutely. And figure out or know how to mix it. I mean, you're likely not going to have just one index fund in your portfolio. You're going to have several different things in there. So, maybe for you the right mix is half in an equal weighted, half in a regular, or maybe neither of those fits into your plan at all. It just depends on the individual, where you are in life, what your family looks like, how much money you make, how much money you're expecting to inherit at some point, and your age and your
Right.
lifestyle. So I mean, there's a million things that go into it, but yeah, I mean, again, just something to keep in mind as you're looking through everything.
Right. And just like we talk about, you go to the grocery store, you don't just throw things in your cart and go to the register and pay. You want to know what everything costs, and you don't go to work and not know your salary. You want to know what your money is paying you. You want to know what your boss is paying you. These are all things you should know as an investor. These are all things you can find out if you work with an advisor like us. So if you have any questions, if that's something you want to do, if you want more insight into what your investments are and what they're doing for you and what's actually in them, give us a call, 215-657-9200, or email us at info@franklinrs.com. One of us will reach out, get in touch, and start working on something for you. Mike, you're the last segment, and we are running low on time, so you got to be quick. What are we talking about today?
Yep. So I'll be as brief as I can. So interesting article from CNBC. Prudential did a survey and found that Americans age 55 years old, so basically 10 years away from retirement, are critically underprepared for retirement. So in the article, they talk about, obviously the fact that there are no longer pensions
Right.
for people to rely on is obviously a big part of that. But one of the things that the article talked about also is a new term that I had never heard of before, silver squatters. And those are people who in retirement because they, didn't save enough. Their plan is, well, I'll move in with one of my kids,
Right.
and that'll help take care of, part of the problem. So obviously, that's one way to go. But that's obviously a conversation you would want to have both with hopefully your financial advisor and also your kids. You don't want to retire and then just show up at their door the next day. So um, they surveyed the 55-year-olds and found that 67% feared that they would outlive their savings compared to 59% of 65-year-olds and 52% of 75-year-olds. They also found that the average 55-year-old American has less than $50,000 in median retirement savings. So, we talk about here just, sort of a back of a napkin math, 4% withdrawal rate. So on $1 million, you're gonna
25,000.
no 4%, so $40,000 per year.
It's about 32,000 after taxes generally.
Right. So obviously if you're 55 and you have $50,000, you're nowhere near close to what you need to be. So the article just brought that to light. And one of the things that it really stressed was really the most important thing that you can do is get a clear picture of where you are financially. And that's one of the things that, we do here is we put that all together on a spreadsheet and give you a clear-cut 30,000-foot view of where you are financially. And then from that data, we can then start to put together an income plan to see if you have enough and to see how we can, optimize that for your retirement so that hopefully you don't need to move in with one of your kids.
And it's not just the numbers, it's not just the total. That's certainly important.
No, it's the plan.
But how much risk do you have in there? What are your outside of the market assets? How are they growing? Where are they? How much of your savings do you end up eating up in a year that you don't realize or don't think about? I mean, some people, we saved $500 a month. Oh, well, that's great. Yeah, but then we take a $6,000 vacation at the end of the year. So,
well, not only that, but I mean, and you guys can speak to this, but how often do we meet with clients and we ask them what their household expenses are per year, and they give us a number, and then we give them our actual expense tracking sheet. And the number that comes back, exactly. The number that comes back is completely different. So
the amount of money people say they spend on meals out versus the amount of money people spend on meals out, two wildly different numbers.
Well, you also have to figure in the cost of owning a home, which
True.
most do at this point in that stage of life, and many of those come up with all kinds of expenses. Or, well, another thing we find is people that are about to retire, they're going to be spending more time at home if they're not planning on moving.
Mm-hmm.
They want to fix up their house. They want to finally do the kitchen. They want to do a bathroom. They want to add a deck, whatever. You know, oftentimes, just anecdotally, we find that happens in the last couple years of work, first couple years of retirement. You know, and that can add up. That could take 50 or 100
Well,
grand off your total.
and that's just planned expenses. Unplanned expenses, people that don't think you don't really think about. Well, we bought this house 20 years ago. It's been a great house. We're gonna improve the kitchen. We're gonna do the living room. How about that year? How about that roof that's probably done?
Mm-hmm.
How about that air unit that's, you can barely get 15, 20 years out of an air conditioning unit anymore.
Mhm.
And it's not like summers are getting colder. And not to mention just, hey, that cute little maple tree you planted in the front yard 30 years ago when you moved in is now towering over the house. And if you're not pruning it, if you're not keeping it up, it's now got dead limbs. That's, all these unplanned things that people don't even know to
Well,
consider.
not to mention that, and like Fuji apples are now like $2 a pop at the store.
Got to go Honeycrisp. Don't mess around with Fuji.
Those are like $2.50.
But that's a lot to think about, and you can't just blame the lack of pensions. I mean, the Studebaker pension failure was in the late 60s or mid 60s. That prompted all the changes in Congress that we got the IRAs in 1974. So that was 50 years ago. So somebody that was 55 years old, they were 5 years old when IRAs came about. By the time they entered the workforce, we were well within the routine of you're managing your own retirement. I don't
Yep.
think we can say it's a lack of corporate oversight of pensions. I think it's more you just can't. People don't save enough, and a lot of times people can't afford to save enough. So having that plan is really important when it comes to managing what you have, because you can't just take the big engine and the big gas tank and floor it and see how far you can coast. You've got to know how you're metering out your money, how you're planning to live, and ensure that your expectations really meet up with what you have.
And your expenses in retirement. I mean, you know, the rule of thumb is that your expenses are going to go down.
To a
But your income is also going to go down.
Right.
You know, now do those things happen most of the time? Probably, but certainly not always. Certainly not always. I there's clients that we have that retire and their expenses end up going way up, or their income goes way up if they are the people that are fortunate enough to still have a pension or two.
Right.
Or they got big IRAs where they're going to have to start pulling big RMDs out of there. I mean, there's a lot of pitfalls that can hit you, and unless you really know what it is that you're looking at, it's really hard to be prepared for what's actually coming down the pike.
And on that uplifting, soul redeeming, just happy note, we're going to have to end this podcast. So all we talked about today was really having a good look at what you're doing, what your plans are, getting that insight, getting that internal detailed look at everything that's going to happen in your retirement. And that's something we provide. If that is something you would like to have in your retirement plan, feel free to give us a call, 215-657-9200. Give us an email at info@franklinrs.com. This is Nick Hamner, Mike Hart, Kyle Plotkin. We are at Franklin Retirement Solutions, and this has been this week's Solving the Retirement Puzzle. We will see you next week.